Hi everyone, and thanks for watching today's video. Today I'm going to talk about UK's response to SARS-CoV-2 in the last 3 or 4 months. The first diagnosed patient in United Kingdom, which was confirmed, was the 31st of January. So we are talking about 3 months and almost 8 or 9 days now since this pandemic has reached United Kingdom. How we have responded to it is fair bit of controversy on it. Some sectors will think that we have responded quite well. Many others, including lots of media, lots of medical staff, including myself, has been very critical about it. However, somebody like me, standing in front of a whiteboard, who has no background in epidemiology, etc., it's very easy for me to criticize the chief medical officer's department or the Department of Health's department. Um, People who are making these decisions, they are making these decisions on behalf of 66 million people. So many lives at stake. Saying that, those are the people who have chosen to make these decisions, so it is their responsibility. I was watching an interview of the Germany's health minister just a week or two ago. And as we know, Germany is perhaps the gold standard in the Western Europe, how they have dealt with this massive infection. And his words were that we are very pleased at how things have responded. However, we should not be arrogant and we should learn from our experience in trying to make things better. We have used our strengths to try and contain the disease and make the outcome better. That was the summary of the interview. He said we should be humble about how we have responded to this disease. On the other hand, if you listen to the interviews from our country in United Kingdom, the first interview I remember very well, or press conference by the Prime Minister, 10 Downing Street was, and the Chief Medical Officer, I believe, was there as well, saying that we are ready for this pandemic. It's the word were we are ready for it. The words were not that we will do our best to contain this pandemic. A few weeks later, when we had a few thousand deaths, we were still way behind the death toll, behind Italy, USA, Spain, and France. We were about 10,000 deaths behind them. Um, I think it was a health minister who said that we are setting an example for the rest of the world to follow how to deal with this huge pandemic. Um, just last week, I think it was, when we had gone past the death toll of France, we had gone past the death toll of Spain, and we were reaching the death toll of Italy. One of the chief minister's officers had said that we are an exemplar for the whole world to how to deal with this disease. Now we have gone past Italy as well, and we have the second highest death toll after USA in the world. So whether what they are saying is correct, to me, where I stand, and where lots of people are looking at, it does not look right that what was done was perhaps correct. I think things were done correctly. However, perhaps the response was too slow, too late, and too little. And that is the title of my talk today. So I'll go through 2 or 3 different things what I think could have done, and they could have done it differently, and how they did it wrong. So first thing, I'm going to talk about how did we do the testing. There is no doubt in anyone's mind the testing in UK has been very, very slow from word go. Last few days, they are trying to test 100,000 to 120,000 individuals each day, but that has been only in the last 1 week. If you look at the per million testing as compared to Germany and ourselves, we are still about 10,000 per million population behind Germany. The numbers we are testing each day currently at present, Germany was doing about 4 or 6 weeks ago. So way behind. The second thing that has come, that recently United Kingdom's government has introduced this app which they are trying out in the Isle of Wight, which is used on the smartphones. So Once the testing is done, if it's positive, then on that app they can do tracking and tracing of that individual, that where that individual has gone to, and to see if they have come in contact with somebody else and who that person has come in contact with. So targeted isolation can be done. Now, currently, with an estimate of between 5 and 10 million people positive of SARS-CoV-2 in United Kingdom, I think it's very, very late to do this. They're trying to follow the lead. They call themselves that we are exemplar for the rest of the world. However, this was done by many countries. You look at South Korea, I give an example. South Korea was doing this from their patient one. They were ready for it from their MERS epidemic a few years ago. And when the first patient was diagnosed, within 24 hours, they knew that patient had gone to a church a day or two before, and 5 people that were sitting around around that patient were contacted and told that this patient is tested positive. They were tested, they were isolated. They could even tell that patient has walked on which path, and everyone that taken that path were warned and tested, which bus this person took, which train he went on to, and that's how they did the testing and tracing. UK government says we got an army of people, few hundred people, that going to monitor this and follow this on telephones. If you start from patient one, patient two, like South Korea did, it is easy to do. You don't need an army of hundreds of people. You need an army of thousands of people, if not more. If you have 5+ million people already positive who are getting in touch with other people. And also in South Korea, using that mobile app was not optional. Almost, as I understand, everyone was using it, was told to use it. In this country, it is an optional app at the moment. So I think on testing, they are way behind. Next thing I'm going to talk about that how did our lockdown go in United Kingdom as compared to some other countries. Now, I'm not saying that lockdown is necessarily essential or the main part of saving lives. For UK, I think it was the right thing to do, lockdown. Some countries can go without a lockdown because their social and structure and the society, the way the society works, is very different as compared to some other societies. In our society, lockdown, I think, is essential. There are countries who have done reasonably okay, I think, without having a very hard lockdown. You got a few countries like Taiwan, you have got Hong Kong, you have got Sweden in Europe. What was problem with our lockdown? I think the first problem was before the lockdown happened on 23rd of March 2020, a week or two before, there was a word from the Prime Minister that we should have social distancing only, like they are doing in Sweden. Sweden, remember, their overall population is less, although Stockholm is quite densely packed. But 40% of the people, not just in Stockholm, but throughout the country, are living singularly in their houses or in their apartments. So having social distancing over there is far easier than UK. Lots of people live in joint families, large families, or at least group of 2 or 3 people living in one household. So having social distancing in UK, I think, was difficult. However, when the first Prime Minister said that we should have social distancing, certain workforce people should not go to work, if possible work from home. So banks were doing it quite early. They were not going to work. As many people as can work from home were doing so. However, construction workers were still going to work, and lots of other offices were still open. So although you're telling the people to have social distancing, and you have trains and undergrounds which are completely packed with people, because train numbers were less, underground train numbers were less, and people going were almost 90% or 80% of what they were before. Few percent were not going to work, working from home or whatever. So trains and undergrounds were completely packed with people like sardines. And how do you call this social distancing? Now, there were still football matches going on in UK, not until just before the lockdown. There was a match, a foreign club and from Spain, and 3,000 of their fans flew over to United Kingdom. Spain had um, SARS-CoV-2 everywhere at that time. Italy had it everywhere at that time. New York was riddled with SARS-CoV-2, but we still had flights coming in and out of UK with no quarantine, no isolation, nothing. You land at Heathrow or Gatwick, you can walk out of immigration onto the streets with SARS-CoV-2, and you can spread it to anyone. Nobody will ask you, have you been checked or isolated or not? There were music concerts going on in London. There were music festivals going on with about 75,000 people packed up in one place. This was just before the lockdown. Prime Minister himself went around to hospitals, met patients with SARS-CoV-2, and shook hands with them. Now, you're supposed to have social distancing over here rather than setting an example. And unfortunately, he himself got the infection. Perhaps that's when he got the infection, and almost, was extremely ill from it, for intensive care unit for quite a number of days. So I think our lockdown was a bit of a sham. One day everything is going on, and the next day everything is shut down. So from one extreme to the other. So as I said in my previous slide, there was no decisiveness. There was no strategy over here that was followed. People or countries who are following non-lockdown or soft lockdown, they have stuck to their guns, no matter what. Look at Sweden. People are dying there, no doubt in my mind. They're dying more than other Scandinavian countries, but they have stuck to their guns. And they're trying to control the disease where it's happening a lot, which is the care homes, elderly people, etc. But we had no strategy whatsoever from lockdown point of view. Last thing I'm going to talk about is PPEs. Just a week or so ago, I heard an interview from the health minister. He was being interviewed on one of the breakfast shows here on Prime Television, and when the question was asked to him about PPEs, and he said, well, we were not short of PPEs. Had stocks of PPEs. However, this virus turned out to be very unusual. They knew about the virus 3 months in advance, what the virus is like in the beginning of January. Every virologist knew about it, how it spreads, etc., etc. And the health minister says, no, this is the health minister who is responsible for the health of everyone in the whole country. And he says, we were only short of some certain types of gowns which were required to stop the spread of this infection to the healthcare workers. Now, I've been working in medicine for a long time. Where I work at the moment, we were trying to get some masks and eye protection just 2-3 days ago, and we still can't get them. When we were ordering our masks, any sleeves to cover our arms or eye protection, this was about 2 months ago. The supply time was in 3 or 4 months' time, in July or August time. And our health minister says that we were not short of PPEs. The only thing we were short of were the surgical gowns. Now, if somebody who has no duty of candor can't raise their hand and say, sorry, yes, we were short of PPEs, we did not think that there were so many PPEs will be required or necessary, we should have done better. But there is no one here who can raise their hand and say, yes, we did something wrong, or we could have done something better. Now, UK government said on the 3rd of March in Downing Street, and a document came out that we are ready for this pandemic. I'll leave you with a small slide which you can search on your own. And this was passed to me by one of my colleagues a few days ago, which shows you that perhaps UK knew 4 years ago, and even then the NHS was not ready for any pandemic, let alone SARS-CoV-2. And I'm most grateful to you for watching. I'll see you very soon. Please stay safe.